Today, we will talk about how pain in the legs and leg joints is connected to headaches and how simple actions can help relieve them. Remember that old classic joke: the spoons were found, but the aftertaste remained. That aftertaste, my friends, is the feeling that we didn't tell you everything about headaches, especially about daytime headaches and how they are connected to pain in the legs, in the hip joints, in the ankle joints, in the knee joints, and how the pain radiates to the back of the body, that very place we call the sacral or sacred lumbosacral region. And the aftertaste also comes from the fact that we so rarely mention the greatest names, the greatest families, the greatest authorities in medicine. So, these very spoons, dear colleagues, ladies and gentlemen, are today a reminder, almost a dessert-like monumento, one of the greatest geniuses, visionaries, and founders of modern psychiatry and neurology. The French genius, Professor Jean-Martin Charcot. Many know this name from the well-known Charcot shower, but few are aware that these very spoons are one of the greatest discoveries attributed to Jean-Martin Charcot. He once said, "No matter what they say about me as an expert in physiology, anatomy, surgery, I would be more flattered if they simply called me an observer." It was Jean-Martin Charcot who noticed that his mother-in-law, who had suffered for many years from chronic headaches, found relief by periodically applying a hot or cold spoon to the base of her elbow or wrist joints. Charcot developed this system, and it later took clearer shape in what we now know as contrast physiotherapy. As you know, many people use the Charcot shower not only for hygiene, but also for psychotherapeutic, psycho-emotional, and physiotherapeutic purposes. And in this sense, Charcot's spoons carry great significance. By the way, this concept of contrastat and cold also appears in traditional Chinese medicine. Going back to the great practices along the Yellow River of Professor Confucius, we recall the idea that the near is treated by the far, and the far is treated by the near, that the hot is treated by the cold, and the cold is treated by the hot. So, Jean-Martin Charcot proposed, if you frequently suffer from headaches, especially during the day, around lunchtime and they are related to spasms, then take the hottest spoon you can tolerate with the inner surface of your palm and apply it to your wrist joint. The headache will pass. But please keep in mind that after the headache passes, you may feel weakness in the lower limbs. And reflexively, that's how we are built. Our large and small lumbar muscles are deeply connected through loops of the small intestine and the mesentery with the occipital region of the head and the brain's ventricles. Therefore, after the headaches subside, especially daytime headaches, we will always experience weakness in the legs, in the pelvic area, in the calves, and in the knee joints. So, to this area, to this place, please apply. Here is the point of the lower back. This is the point of the lower back. So, please apply what? The coldest spoon possible. And if you frequently experience pain in the hip projections, if your pelvic area often hurts, if your knee joints often hurt, if your ankle joints often hurt, If you feel a tendency towards spasms in the lower limbs, or experience cramping, or have restless leg syndrome method, in this case, you need to take the hottest spoon possible. Apply it to this area, to this point, and then apply the coldest spoon possible to the area of the occipital vessels. So, what is the proper frequency of applying this method to these areas? Keep the cold spoon in place until it warms up to the point where you feel it is no longer cold but warm. And the hot spoon should stay until it no longer feels hot but just normal. These simple techniques can serve you very well as emergency remedies. But please don't forget that emergency help is exactly that, emergency help. And the knowledge of the systems and mechanisms that lead to the development of spastic or atonic conditions in the blood vessels of the brain, neck, and collar zones, well as the issues with the hip joints, knees, ankles, feet, and the muscular framework of the lower limbs. This is always connected to how our liver, gallbladder, spleen, and pancreas are functioning. Therefore, please pay close attention to our newsletters and to the information we share with you. We are always happy in every meeting with you to share and demonstrate the secrets of improving your health. In the upcoming webinar, we will tell you about our innovation, our new invention and technology to combat atherosclerosis. We will talk about fat metabolism disorders that are common in people with impaired liver and gallbladder function. The registration link is in the description below this video. Sign up and join us. You are very welcome.